Welcome to Wanja's Health Diary. This week we'll discuss about cancer, a disease that affects each one of us in one way or the other. We have Dr. James Mbogo, who's going to take us through a discussion on what is cancer, the risk factors, and also where to get tested. Welcome, Dr. Mbogo.
Thank you, Joy.
Tell us, what is cancer?
Cancer is basically defined as an abnormal proliferation of our body cells. Normally, our body cells die after a few days or a few weeks or even months, depending on the organ. But cancer cells do not die. They continue growing and multiplying, and then they spread and they invade tissues that are surrounding them until they are either removed by surgery or treated with chemotherapy, which is medicine, or with radiotherapy, or sometimes till the host, which is the patient, dies. That's when the cancer cell stops growing.
In terms of diagnosis, how do you get to know that you have cancer?
Well, initially, it's a patient who presents with a certain symptom. Like for the breast, they may have a painless breast lump, which in more than half of the patients is accidentally discovered. They report to their doctor, who examines them and then may recommend a test such as a mammogram. For other cancers, like say cancer of the cervix, patient may come with abdominal vaginal bleeding. Again, the doctor examines them, may see a growth on the cervix, and then takes what is called a biopsy. But actually for most cancers, a test called a biopsy has to be done, where a sample of the abnormal tissue or of the abnormal growth is removed, taken to the lab and examined under a microscope. Be it prostate cancer, be it cervical cancer, be it breast cancer. But initially the patient must have a certain symptom, and all cancers are investigated differently.
And upon diagnosis, how do you stage and be able to confidently say this is stage 1, this is stage 2, 3 and 4?
We have a universal staging system that is called the TNM, tumor, node and metastasis. Tumor refers to the growth itself, how big it is. For some cancers, it's the size of the tumor, and then is it invading the tissues that are surrounding it. So all cancers are staged from 1 to 4, and the lower you go, the more advanced the staging is, and unfortunately the lower the survival. So normally for us to stage, first the patient comes, we've examined them, we have a biopsy confirming that yes, this is cancer. Let's say for the breast, even if you did a mammogram, it showed that yes, there's a tumor in the breast, or rather there's a growth in the breast that is suggestive of a cancer. We have to do a biopsy. So we do a biopsy, it says this patient has breast cancer. So the next thing, because like breast cancer commonly spreads to the lungs and the liver. So we do a basic test like a chest x-ray or abdominal ultrasound to look at the lung and the liver respectively. Then if it has not spread, we have different staging based on still the TNM. We have stage 1, 2, 3 and 4. And even some cancers we have 1A, 1B, 2A, 2B, 3A, 3B, etc. And that actually helps us. Based on that, then tell the patient, because you're on this stage, this is the type of treatment that we are going to give. For stage 1 to stage 3, for majority of the cancers, it's curable. Surgery, chemotherapy or radiation therapy, depending on the cancer. Stage 4, where the cancer has spread, some cancers have stage 4A and 4B. Like cancer of the cervix, 4A is it has invaded the rectum and the bladder, which are surrounding organs next to the cervix. We can still manage that with radical therapy, chemotherapy and radiation therapy, and then an internal radiotherapy, which you put radiation inside the cervix. We call it brachytherapy. But stage 4B, the cancer has already left the cervix, maybe has gone to the bones, the lungs, or the liver. That is not curable, but it is manageable and controllable. So we give medication, usually chemotherapy, to control the disease, to improve symptoms. Basically, those are the main aims now.